Hi everyone, I'm Dr. Roman and I'm a blood and cancer specialist, and today I have the pleasure of discussing with you DVT and PE. That's right, very important topic. So let's get into it. But before we do, remember, I am not your physician. This video is for educational purposes only. I am not giving any medical advice. So let's get into it. All right, so let's start off with the definition. These are all blood clots. A DVT is a blood clot that forms in either our legs or our arms. For this discussion, we're going to stick to blood clots in the legs. When a blood clot is in the arm, it's usually induced from either a catheter or an IV line that you had put in, and that provoked the blood clot. The blood clots in your arms are a little less dangerous because the caliber of your blood vessels in your arms are thinner. So if you have a pulmonary embolism, they tend to be a lot smaller. So for this discussion, we're mainly going to be talking about DVTs of the lower extremity. They're kind of treated the same, but there are some differences. So make sure you speak to your physician if you have a blood clot in your upper extremity. Now, a pulmonary embolism is when one of these blood clots in the legs or the arms breaks off and they travel to our lungs. These can be life-threatening, and this is what we fear the most when you develop a DVT. Now let's talk about symptoms. So let's stick to the DVT. So if you think about it, if you have a blood clot in the leg that's obstructing blood flow, one of the first things that's going to happen is your legs are going to swell up. Now, the type of swelling usually is one leg will swell up out of proportion to the other, or one leg will be swollen and the other one is not. So if you ever see someone or you ever have swelling in one leg and not the other, or more so on one leg than the other, then it could possibly be a DVT. Know that pain is another very common finding, as well as skin changes. This trio, if you have them, the swelling, the pain, and the skin changes, you should think of the possibility of having a DVT. Now, PE, if you think about it, this is common sense. You have this blood clot that broke out of your leg from the veins of your leg and ended up in the lungs. Okay, this is going to compromise blood flow. Now your heart is going to have to work harder to pump blood through your lungs. So that's going to lead to shortness of breath, chest pain, palpitations, low blood pressure, and tachycardia. Now, none of these are specific to a pulmonary embolism. Okay, maybe you have the shortness of breath and the chest pain and you don't have any of the others, but sometimes you have all these findings. Just know that chest pain, shortness of breath, the tachycardia, any one of these could imply that you had or are having a pulmonary embolism. And that's important to keep in mind, because most people think if I develop shortness of breath and chest pain, it might be a heart attack. Just know that there are other things out there and not just a heart attack. Now we're going to get into the causes. So this is a very important topic, and I want to spend a little bit of time on this. So I can tell you that the number one, the number two, and number three cause of blood clots or DVT PE is immobility. Let me repeat that. Immobility, because we're going to go over this several times when it comes to treatment and other decisions that we have to make. So let's, as an example, let's say you fell and you sustained a hip fracture and you're in bed. That's a risk factor. A long plane trip or a long car ride, let's say 10-hour plane trip, that will increase immobility. If you're ill and you're in bed, all these causes of immobility will increase your risk of blood clots. Very important, it's the number one cause. Now, cancer. There are types of cancer which make your blood hypercoagulable. In other words, they increase your clotting risk. So just know that if you have a person or if you've ever had a blood clot and we do not know why you had this blood clot, you were not immobile, you were moving around, you were doing well, and all of a sudden you get this unknown blood clot, just know that cancer could be a reason. Now, this is rare, but it is possible. Smoking, obviously. What doesn't smoking cause? Hormone replacement therapy, so estrogen or testosterone, can increase your risk of blood clots. Now, if you're a smoker and you're taking these medications, obviously that can increase your risk. If you're immobile, you had surgery, you fractured a hip, you had knee surgery and you're on estrogen or testosterone replacement therapy, obviously this can increase your risk, so always keep that in mind. There's a medication that we use in breast cancer. It's called tamoxifen. So if you've ever had a blood clot, or if you're immobile for whatever reason and you're on tamoxifen, just know that your risk of DVT and PE may go up. Pregnancy. When a woman is pregnant, her hormone levels are going crazy. This can definitely increase your clotting risk. Just know that the left leg is more prone to blood clots than your right. So if you ever see a pregnant person and they have a lot more swelling on their left leg than their right leg, think of the possibility of a DVT. Now, most pregnant women, especially when they're further along, do end up with some degree of swelling of their legs. So most pregnant women will not develop a blood clot. But if you notice excessive swelling of the legs, or edema as we say in medicine, more so on the left than the right, think of the possibility of a DVT. Now, some can get it on the right. I'm just saying that it's more common on the left. Obesity obviously can increase your clotting risk. Now, hereditary. There are some people that may have a strong family history of blood clots. And if that's your case, think that maybe you have a genetic predisposition to forming blood clots. All right, so I hope you're having fun. I urge you to find the next video, which is video or part 2, where we discuss the diagnosis and the treatment of DVT and PE. So I'll see you there.